Israel has started COVID-19 vaccinations for 12 to 15-year-olds. More than half of the country has been fully vaccinated, allowing it to lift almost all its virus restrictions. The picture across the border in Gaza, though, is very different. Rami Al-Meghari reports.
Gaza may have just come out of the latest conflict with Israel, but health authorities here fear they may soon face another battle, this time against COVID-19. The 11-day conflict brought Gaza's health system to the brink of collapse at a time when health officials have been trying hard to contain the spread of the virus. Dr. Omar Manasra from Gaza's largest hospital says the situation was especially bad for his critically ill patients.
During the Israeli attack on Gaza, the situation was very difficult, because the hospital was crowded by the injured patients, the patients after explosive injuries, and so on. So it was not easy for us to deal with corona patients in these situations.
Gaza's only COVID-19 testing laboratory suffered damage when a neighboring building was hit by an Israeli airstrike. Before the conflict, it was conducting 3,000 tests daily. But now authorities are only managing around 600 tests a day, at best, at a separate facility. Dr. Majdi Doher from the Palestinian Health Ministry in Gaza worries about the number of infected people who have gone untested.
So they were a source of infection for others. This may affect the wave, of course, and the number of cases discovered, and of course the action taken to stop the spreading of COVID-19.
Since March 22, Gaza has recorded more than 107,000 COVID-19 cases in a population of just 2 million. There have also been more than 1,000 deaths. Exact figures are hard to establish because health authorities are still dealing with the fallout from the bombardment, which has also seen a new indifference among Gazans to safety measures against the virus.
They are not on the mood, so they are just checking the destroyed houses, the facilities they lost.
Safe distancing is almost impossible, especially for more than 50,000 people who have been displaced from their homes. They had stayed in crowded shelters. Maintaining good hygiene is also difficult, as about 95% of Gaza has no direct access to clean water. Some medical officials are calling for tighter restrictions, but authorities are reluctant to do so. They say that will further devastate the economy, still trying to get on its feet. What they can do now is try to resume vaccinations.
المفروض اخذ الجرعة الثانية، ولكن تواصلت مع المركز الطبي اللي بتناول منه الجرعة، فقال الآن تعرف الوضع صعب ولا يمكن الآن استقبال أي من المواطنين لأخذ الجرعة الثانية، ففي مركز عيادة المغازي.
Gaza's vaccination program has been extremely low. Less than 2% of the population has so far been inoculated. The Strip has been relying on getting the AstraZeneca and Sinopharm vaccine through the COVAX vaccine sharing scheme. But even before the conflict, it was a challenge getting the vaccines into Gaza because Israel and Egypt restricted Gaza's access to the outside world. Humanitarian assistance is now being allowed in, and more vaccines will be arriving. Since the ceasefire, China has donated 100,000 of its Sinopharm vaccine. Health authorities hope this will speed up the vaccine program, as they fear they will not be equipped to deal with the crisis if the virus starts spreading out of control. Rami Al-Meghari, CNA, Gaza.